Today, we learn how to place the composite in posterior teeth. So, just I did a case today, and I recorded it for you. So I want to show the case, the how composite is placed in the posterior teeth. So this is the tooth left lower second molar, and it was gradually carious. So it was just caries removed and aged. Most is dystolingual pus was more carious, and just after the aging, and I have applied the bonding agent all over the dentine and the enamel surface. So and just here some cotton fibers. I place the cotton roll here. I must place the rubber dam, otherwise there should be a rubber dam when you do the composite posterior teeth or in anterior teeth. Composite restoration isolation must be done with the rubber dam. But because of this posterior tooth and the third molar is not so visible, placement of clamp and rubber dam here is a bit difficult. So that's why I use the cotton roll for isolation, which is somehow the compromise in terms of the isolation. So after applying the bonding agents, just cure it for 10 to 15 seconds. And then I have applied the flowable composite, just give a thin lining at the floor. Because when you apply the thin lining of this flowable composite, your main your restorative composite have a good adaptation with the floor of the cavity. So that's why the thin lining, it should be kept minimized thin lining. It should not be so thick enough. So after the flowable composite, main restorative composite is used at the floor of the cavity. Alternatively, you can use the uh, work fill composite as well are available to just make the base of the cavity with the composite, and then you can cure it again for a few seconds. So that's a floor covered on the base made with the composite. Then an increment was placed to just to build the distolingual cusp. So the placement is like this, and just cure it for a few seconds again, 5 to 10 seconds. Cure it. Okay, that's not a full curing, but it's a bit cure. Then the next increment is applied to build the disto, sorry, mesolingual cusp and the lingual groove, which is between the two lingual cusps. So using on this plastic instrument to give the shape to the lingual groove and cure it. So after each increments, you can cure for 5 to 10 seconds, sufficient time. And then I build the testobuccal cusp. As you can see, the uh, triangular ridges of the cusp made. The excessive should be removed. And finally, then again cure it for a few seconds. Just a bit more building this distal ridge of the mesolingual cusp, and finally you can press the side of the plastic instrument against the ridge of the cusp to make the shape and to give the shape to this the ridges of the cusp, and the can move the grooves. Okay, so this is how you have to use your plastic instrument to give the shape to your restoration. Then finally you can cure it. Okay, just this is how the fill somehow repeating the video is repeating it. And working in these most posterior area like here, controlling saliva and all is the it's very challenging. There should be no any contamination of salivary contamination will spoil your whole job and your hard work. So rubber dam should be used if it is possible. Incremental use and curing it for few seconds, decrease the polymerization shrinkage. So this is the final restoration, and that's it for this video. And now that is the after that there is a some final pics of that work. And the same case, this is the the you have to check the occlusion, the stops. There some stops are if you place it properly and make the proper ridges and inclinations, there is hardly any stop on your restoration. But if it is there, you have to remove it with your burr and give final shape to your restoration. After the occlusal adjustment, you can should polish the composite restoration. Composite restoration should be polished, even if it is a posterior tooth. So if it is a polished, there is a less, retention of the block, and there is because of that, there is a less chance of the secondary caries and or even the staining of the restoration. So there are different ways to polish the composite restoration. These are the cups you can use. They are better to polish the ridges and grooves, and some disc even can be used. So finally, this is the final restoration after finishing and polishing, and it's much like it has a natural appearance, and it's very difficult to differentiate it. The tooth is restored. So this is how if you place it properly, and there is a proper manipulation and placement and proper use of your plastic instrument and making the anatomy of the occlusal surface, and then finally do the occlusal adjustment, and then finally you polish the composite restoration. So this is bit about this placement. Hopefully, further we will do more these videos, and I will share you, and we will learn together. Thank you so much.